Are you a pitcher dealing with shoulder pain every time you pitch or play catch? I want to go over today the different types of shoulder pain and reasons as to why you're having shoulder pain in certain areas versus others. How do I know this? My name is Dr. Jeff Lewis. I'm the owner and physical therapist of Lewis Physical Therapy and Sports Rehab in Point Pleasant, New Jersey, and I have helped countless baseball players, primarily pitchers, get stronger and back to throwing pain-free. So, shoulder pain with throwing. It sucks. It is one of the more frustrating injuries or things to deal with other than elbow pain with throwing. First off, you shouldn't be having arm pain with throwing. If you're having arm pain with throwing, there's something going on. You're likely not going to be able to keep throwing through it. And it's more a matter of making sure you get properly evaluated and determined what your injury actually is. And the shoulder, very much like the elbow, but the shoulder is a complex joint. It is the most mobile joint in the body, which is a good and a bad thing for pitching because you need significant shoulder mobility in order to generate more velocity. But at the same time, you need a ton of stability from dynamic structures such as your muscles around the area to support it. So what I want to talk about today is specifically bicep tendon pain, so pain on the front of the shoulder, and then pain in the back of the shoulder, and some couple different things that we look at there. So pain along the front of the shoulder, I would say more often than not, I have guys that when they have pain on the front of the shoulder, it's usually right over the bicep tendon. And the bicep tendon is that ropey structure right on the front there. When you find it and you pop over it, now here's the thing. It's gonna be painful and bothersome for most guys, but whenever I'm evaluating that area, I'm always asking, when I'm on that structure, hey, does this feel like this is where your pain is when you're throwing? And if it's a no, then it's okay. We have to evaluate some other structures, but more often than not, if that bicep tendon is the pain generator, when you're on that and you ask them, hey, is this where your pain is, where you're feeling? That's probably going to be, their answer is probably going to be yes. So whenever we talk about the bicep tendon, we need to talk about the labrum because that bicep tendon attaches up to the labrum. And there's a lot of different discussion of whether, hey, is it the labrum that's the pain generator or is it the bicep that's the pain generator? Most throwers, especially pitchers, probably have an underlying labrum tear that are just walking around with asymptomatic, meaning it's not painful or bothersome labrum tears. Mainly because in order for pitchers to be able to get maximum external rotation in the layback, there's what we call the peel back mechanism of that labrum, where that labrum literally gets pulled away from the glenoid, which is where it attaches, and the bicep twists and then it pulls that labrum away, and that's what allows them to get maximum external rotation. So I do feel like that most pitchers are probably just walking around with a labrum tear to begin with, and it just might not be painful more often than not. Most commonly, what I see is the bicep tendon being the problem more often than not for guys. And the bicep tendon, again, it runs from the big meaty bicep, it runs up the front of your shoulder and it splits off into two. It splits off into the short head, which attaches to the coracoid, which is a little closer to the pec, and then your long head, which runs along that front of the shoulder up to the top part of that labrum. And that's usually the area where I see guys usually be more bothersome more than anything. And typically during throwing, when they feel it, is getting into late cocking. When they get their arm to maximum external rotation, they're getting a ton of stress on that bicep. Some guys will feel it too when they're accelerating out of that because they now have to use the structure on the front of the shoulder to come out of it. And it's going to put stress on that bicep. Some guys will also feel it at ball release or follow through because as you get into that rapid elbow extension, you're going to get more of an eccentric stress on that bicep. So a lot of it just plays into where's your pain, where are you feeling the pain with throwing. It's usually whenever I get a guy that's dealing with some bicep tendon pain, when they get into external rotation back there, when I bring them into maximum external rotation, that's usually when they feel it. With these injuries, more often than not, it's a lot of scapular work. I've seen guys that have flared up bicep tendons and they have really weak rotator cuffs, which can certainly play a role into it. But I've also seen guys that have bicep tendon pain and have a strong rotator cuff. But it's more a matter of, hey, we manipulate their shoulder blade position and their pain goes away. And the reason that is because when your shoulder blade, you don't have certain strength or control in certain areas, you're naturally going to put a lot more stress on the front of your shoulder with those shoulder blades tipped forward like that. And when you go to externally rotate your shoulder as far as you can, there is so little room to begin with there, and it's just going to put more stress on the bicep. So that's where a thorough examination and evaluation process is important to determine, hey, is this a rotator cuff strength issue? Is it a stability issue? Is it a scapular strength issue? It could be one of those or it could be all of those, and that's where we just need to make sure we get a clear picture of it. Now, when we're talking about pain along the side or the back of the shoulder, now we're probably not looking as much of bicep tendon. We're moving away from that now. So we're going towards the back of the shoulder here. We're starting to look at, okay, is there some type of rotator cuff involvement? And typically with rotator cuff, you'll see, guys, it's not as much of an issue getting into external rotation. It could be because they have to use that rotator cuff, but it's usually at the follow or at release and follow through where they feel it, because you're getting that rapid deceleration eccentric stress on the rotator cuff. And the job of that rotator cuff there is to slow down your arm. So if you have a rotator cuff issue, that's typically where you'll feel that there. Now, the other side of this, when we're dealing with pain in the back of the shoulder, like if a guy comes in and they say, hey, I have pain right on the back of my shoulder, right here, and I don't necessarily feel it, which again, that's near the rotator cuff. But if they're like, hey, I don't feel it at release, I feel it more when I'm getting into external rotation here, now we're starting to look at a little bit more what's called internal impingement, which is essentially that rotator cuff tendon, as it's coming around here, is getting pinched as they get into maximum external rotation there. So again, same structure that could be affected here, and there's usually a little bit more labrum involvement with that too, potentially, because as that arm is getting into that back position, you're getting a little bit of a pinching on that rotator cuff and possibly that labrum. But it's going to be treated probably a little bit differently in the sense of when you have that pinching in the back and you get into layback external rotation, it's going to be a lot of looking at what does your posterior capsule flexibility, mobility look like. Again, it'll eventually look very similar because at the end of the day, we'll still have to recondition the arm to get back to it. But those are just 3 different examples of some of the more common shoulder issues that I see in younger and high school collegiate pitchers and throwers as well. And that's really how we go about a little bit of a different course for an evaluation and examination when we hear certain things in that process. So if you're a pitcher, baseball player, dealing with some shoulder pain whenever you throw or pitch, go ahead and leave a comment below with any questions you have. Like and subscribe to our channel. We put out a ton of content on a weekly basis for baseball player rehab and performance training.